There we go. Hi, everyone. Good morning and welcome to Nurturing Strong Relationships to Activate Your Comprehensive Prevention Plans. This is day 2 of the 2024 Statewide Collaborative Prevention Convening. And my name is Sarah Lacroix, and I'll be your MC for today. When I'm not MCing, I'm a co-lead for Strategies Technical Assistance, and I'm with the Children's Bureau of Southern California. I'm also the director for the Los Angeles County Child Abuse Prevention Councils. In partnership with the Child Abuse Prevention Center in Sacramento, Strategies continues to support prevention collaboratives, child abuse prevention councils, and family resource center networks throughout the state. We're thrilled to come together again today with all of you here, and we have a variety of subject matter experts in the field, and most importantly, we're here to support your in-person connections with your CPP teams today. Before we jump into our content today, I just want to take a moment again to thank the 30+ members of the statewide convening planning team who've come together since August of 2023 to make this event happen. This year, we had the most robust, diverse, and planning team to date, with representation from parents and youth with lived expertise, tribes, various county and state departments, state associations, CAPCs, and community-based organizations. We sincerely hope the program today is supportive of your efforts to create change, and thank you all for being here. Next slide. Okay, so just a little housekeeping for today. So this event is in a webinar format. I know a lot of you are in person, so that won't make such a big difference as it did yesterday, but that means you won't be able to turn on your mics or cameras in the main session. We're using Zoom events today, also yesterday, because we'll have, although we have more people in person, I can't quite see how many total just yet. We had 800+ people yesterday virtually, which is incredible. And Zoom events gave us a lot more capabilities and just allowed us to manage a group of that size even better. So I recognize there are some different things about Zoom events that we're all learning. So thank you for your patience with that. And please know the event is being recorded today, and a link to the recording will be provided to participants shortly after the event. We recorded yesterday as well, and you'll be provided with that additionally. So the slide deck is now available under the Resources tab, which is located on the Zoom toolbar, and will be provided in the chat as well. If you have any questions around content, we ask you to please use the Q&A feature, which is located on your Zoom toolbar on the bottom of your screen. You can use the main session chat here for comments, reactions, reflections. I saw a lot of great emojis and clapping and hearts yesterday when people were really appreciating the presenter. So feel free to do that again. Also, we have, if you have any tech support needs, please place them in the lobby chat. So you're in the main session here, and you'll have your browser open for the lobby. So just head back to the lobby and enter any support needs in the lobby chat, and our backend support tech team will be able to help. We also ask at the end for folks to please complete the evaluation survey, which we'll offer both as a link in the chat and as a QR code. So that way, if you're in the room with your county team together, you'll be able to scan that and still do the evaluation. It really helps us to plan for next year. So kindly ask that everybody please take a moment to do that as we get closer to the end of the day. All right. Also, additionally, last thing, if you have any specific questions related to community or tribal engagement, please place them in the Q&A chat here as well. And we're going to have 2 different segments with our subject matter expert, Junious Williams, today. So if there are any questions you'd like to ask, please place them there, and we'll go ahead and collect those and can potentially have them answered by Junious in the afternoon, of course, if time permitting, to answer them all. Okay, I'm going to do a little overview of Zoom events. As I said, because it is a new platform, we've been learning it as well. So keep the browser with the lobby open throughout the event. This is how you'll access this main session and any county sessions if your county is participating virtually or in a hybrid format. If you should accidentally exit the browser with the lobby, you just rejoin by clicking on the link that you came your ticket in your email confirmation or your calendar. So during transitions to county team time, if your team is virtual or hybrid, you'll leave this main session. You do that by clicking leave, and then again, the leave webinar. You'll return to the lobby via your open browser and go to the session and click on your county Zoom session. So you'll see some of the arrows and indicators here. If your team is fully in person, you can keep this main session open or leave the main session and return when it's time for the plenary presentations. It is completely up to you. And again, for any tech issues, enter your questions in the lobby chat. We did also pin the Zoom events guide at the top of the lobby chat if you should need to reference in there. All right, next slide, please. Okay, so in trying our very best to remain a trauma-informed event, this year the planning team decided we wanted to offer emotional support at various times throughout day 1 and 2. We recognize that many people here have been impacted by trauma and family violence, and encourage you to call or text the number here to be connected to one of our clinicians should any difficult feelings surface for you at any point in the event. You'll see the schedule for those 2 clinicians here today, Dr. Priya Batra and JV Bardaki, who's an LCSW. So we'll put that phone number in the chat as well, so folks have it as the slide continues. But again, these are resources. They are free of charge and here for you today, so please feel free to use them. All right. So our purpose for today, day 2. So we really hope, the planning team really hoped for this to be a working convening where teams could get things done, can deepen your relationships, develop some action steps, and maybe welcome new team members in as well. We hope that you'll have a great number of opportunities for sharing and learning from your peers, and really go deeper on community and tribal engagement, which of course is one of our main objectives across these 2. Next slide, please. Okay, so here's the overview of our agenda for today. What you'll see is that the times in blue are your county team time discussion sessions. So that's when you'll be, in your space, or there are a few counties that are here with us virtually. That's when you'll get together with your team for a variety of different activities and connecting exercises. So we'll have some welcomes this morning. I will then hear from Janae Eustace, the new CEO of the Child Abuse Prevention Center. We'll have some county team time. We'll have some peer sharing, community engagement reflections from a panel, do a little framing for the day, and then you'll go back into your county team time to get started. There'll be a lunch break, 1-hour lunch break, and then we'll come into an afternoon Q&A session with Junious Williams. That'll be our first part. You'll then go back into your county team time and doing some charting your course for action, and come back to the main plenary, and we'll do afternoon Q&A session with CDSS, the California Department of Social Services, and also Junious Williams for part 2, related to community and tribal engagement. We'll have a presentation on the state of prevention in California, followed by a presentation on CalPrevents, which is the Statewide Connect platform. And then we'll wrap up and have some closing appreciations. Thank you. Next slide. Okay, so one thing we'd love to do is find out who is in both the virtual and physical rooms today. And so we're going to do that through a tool called Mentimeter. At this point, I know a lot of folks have seen that, but what you can do, there's a link that's been dropped into the chat if you are joining us virtually, or if you're in person in the room, if you can please scan the QR code here. It'll take a minute to do that. And there are going to be 2 questions that are going to come up. The first one is going to ask, what is your affinity group? So what group are you most connected with collectively as you've been doing this work? And we'll spend a little time to give folks a minute to do that question. And then our second question is going to be, what California county are you located in or representing today? So I'm not able to see, but hopefully folks are getting started with that. So what is your affinity group? And let's see, oh, thank you. So those should start to come in. If you need support in any way with Mentimeter, just drop a question in the chat. We're trying to get the, oh, thank you. So Bryn just put in the chat again, the Mentimeter All right, so take a minute to do that first question, your affinity group. It looks like we're having a little bit of trouble with it, but let's see.
Sorry about that. Again, we do have some tech trouble. It looks like we have more participants than we had anticipated. So we're not able to showcase this right now, but we will be able to collect the data on the back end and then present it with you all.
Wonderful. Thank you. Yes, we don't know how many people are in person today, so we're hoping to use this tool to help us kind of get a feel for that. But like I said, yesterday was 800, I believe close to 850 people, which is incredible. So I imagine we won't be that many, but not far off from that. So Serena, if I'm hearing right, we'll circle back to the poll a little later in the afternoon.
Yes.
All right, so our next slide, please. All right, wonderful. I'd like to put a warm welcome out to Alyssa Burke, who is the CAPC coordinator for Western Nevada County. Alyssa has been a part of the planning team, Alyssa, at least the last 2 years, if not 3 years. We're really excited to have her here today and to be a part of the welcome. So Alyssa, I will turn it over to you.
Hi, thank you. Good morning, everyone. Thank you, Sarah, for that kind introduction. Hi, everyone. My name is Alyssa Burke, and I'm so very glad to be here today and also to have been a part, as Sarah mentioned, of the planning team for the last few years. My name is, again, Alyssa Burke, and I'm a youth and parent with lived expertise. As a child, starting at the young age of 8, and throughout my adolescent years, I was in and out of the Nevada County foster care system. I'm a survivor and overcomer of teen dating violence and domestic violence. I became a teen mom at the young age of 16, and my son is my most treasured gift in life. As a parent with lived expertise, I've been serving my community for over 15 years. In my previous roles, I was an active part both personally and professionally, serving clients, children, youth, and women who endured domestic violence and who were desperate for healing. I was a parent, youth partner for youth and parents receiving high fidelity wraparound services, an active community member in the faith-based community, volunteering to serve, mentor, and come alongside youth who find themselves facing hurts, habits, and hangups in a faith-based recovery setting. After many years of providing strength-based intervention services, I had a career change in 2020 and was given the opportunity to become the CAPC coordinator in my community. And since then, my passion for prevention continues to grow daily. One of the many reasons why I personally feel folks with lived expertise are valuable is because folks with lived expertise who have been through something know the nuances of dealing with it and healing from it. They know what works well and what doesn't work well. While empathy is needed and beautiful, empathy can't always replace the lived expertise. The insights that lived expertise and experience can offer is an invitation for others to be an active and reflective listening ear and stepping into the arena with those who have the lived expertise, gathering insights that they have to offer that hold real and significant value. More often than not, those with lived expertise are sometimes judged rather than welcomed and valued. Majority of youth, parents, and guardians that are brave enough to share their lived expertise have the strong desire to make a positive impact in their communities and to help break the chains of trauma in their families and communities. I encourage those on the meeting today to step into the arena with those in your community who have the lived expertise. Believe in them and make room for them to be the catalyst for sustainable change in the communities they live in and to create and present opportunities for lived expertise leadership opportunities for both youth, parents, and guardians. Today, I'm going to be doing an overview of our day 1 and bridging us into our learning session for today, day 2. So day 1, just an overview with our tribal community. We went over the cultural view of time and process, tribal sovereignty and governance, status and constitution, tribes' daily operations, system and equities, passion and authenticity, the county going to tribal land rather than being asked to come to the county, and whose table are we inviting the tribes to? These are the important overviews of what we discussed yesterday with our tribes. Our day one workshop overview was connecting community engagement workshops. We had the engaged lived experience workshops, the parent partners as community engagement strategy. We had commitment and compassion, nurturing the voices of lived experience, partnering with lived experience in Santa Clara County, strategies to engage youth in prevention work, shifting power to communities from Sacramento, Ventura County Parents' Voices, Pathways to Success, the well-being of LGBTQ, youth and foster care, the Youth Acceptance Project, Journey to Success, Bringing Youth to the Table, and the Youth Advisory Council. So day one was a very rich day full of much needed conversation and much needed work groups, and they were both wonderful. I'm going to share a little bit about what my county is doing in Western Nevada County. And part of our CPP process is that our county, we submitted our CPP and it was approved. And now we are in the early stages of trying to determine our best next steps. We are in the process of forming a parent guardian advisory council in hopes of providing a safe and supportive space and place for parents and guardians to be able to share their lived expertise and provide supporting opportunities that encourages parents and guardians to find and use their voice and to advocate for change within Nevada County leadership and our community as a whole. An additional focus of the Parent Guardian Advisory Council is to have a place where the voices of the parents and guardians are honored, valued, and respected, and where sustainable trust and rapport is built and nurtured. I will also add that our county also has a Youth Advisory Council that recently started. The Parent Guardian Advisory Council will have monthly meetings for a minimum of 1 year and hopefully longer. And the topics of those meetings will be brainstormed, decided on, and led by the parents and guardians. And the meeting will be facilitated by the CAPC coordinators, both in Western and Eastern Nevada County. We are working on coordinating an all-inclusive motivational interview training in both Western and Nevada County. Lastly, we are having open dialogue with our local FRCs to provide a community pathway for families. I also want to share with what our county is doing for CAP month. So as most of you may know, April is Child Abuse Prevention Awareness Month. And our county, Western Nevada County, was recently awarded a $9,999 grant from OCAP to do our CAP month activities. We are hosting an all-inclusive community barbecue with the focus on connecting our community. We are inviting members of our community to be superheroes for prevention. Community members are invited to wear their favorite superhero costume or come as they are and play in blue bubbles, engage with each other over a tasty meal, and continue to build supportive collaboration and trust and rapport. In our community, we are also going to be focusing on Be the One. And our Be the One campaign is that everybody has the opportunity to be the one. We can be the one to make a difference in the lives of those that we serve. Be the One originated from, oh goodness, I'm sorry, I'm trying to remember the county. Oh, I'm so sorry. Anyways, Be the One is smile, listen, care, and share. In our communities, ways that I want to invite you to be the one, not only in April, but every day, is you can be the one in your own home. You can be the one at work. You can be the one in your neighborhood. You can be the one in schools. You can be the one in community groups, and you can be the one in social media. There are many ways to be the one, beginning with a wave, a smile, or both. Small acts of kindness can have a big impact. Advocating for others who are not in a position to advocate for themselves can transform not just one life, but whole communities. A willingness to listen and learn about others with a sense of wonder and free judgment is a key step in creating a caring community. And Be the One is from Yolo County. I also want to share that we are, for the month of April, we are going to just again promote that child abuse prevention is possible. And I want to invite everybody on this call, if you haven't previously been involved in any of your Child Abuse Prevention Month activities, I want to invite you today to be a part of those activities. They are critically important in playing a role in engaging our local communities and educating them on the importance and the possibility of child abuse and neglect prevention. Now I have the pleasure of introducing our next speaker, Janae Eustace, President and CEO of the Child Abuse Prevention Center. Janae Eustace is the President and CEO of the Child Abuse Prevention Center in Sacramento, California. The mission of the Child Abuse Prevention Center is to prevent child abuse and neglect through a spectrum of prevention at the local, statewide, and national level. Janae was previously the Executive Director of California Youth Connection. She has worked for the California Welfare Directors Association and as the Quality Parenting Initiative Champion and Youth Engagement Lead at the Youth Law Center. When she was a Sacramento County Child Protective Services social worker, she advocated to establish the Sacramento State University's Guardian Scholars Program, which still continues to serve systems impacted parents, families, and youth today. She first became involved with prevention and systems transformation work during her time in the foster care system. One of the many accomplishments Janae is proud of is helping execute the California Fostering Connections to Success Act nationally and implementation across the state of California. Janae is committed to ensuring the integrity of prevention frameworks that are fundamentally rooted in diversity with a community-led partnership. She graduated from Sacramento State University, where she received a bachelor's and master's of social work degree. Janae is also an immensely proud wife, mother to 3 amazing boys, sister, chosen sister, godmom, and auntie. Janae, thank you so much for being here today, and we welcome you.
Thank you so much for that introduction, Alyssa. I really appreciate that. And it's so wonderful to be here with you all today. I feel like this is really exciting because I'm really coming home, and I'm literally here in Sacramento County, sitting amongst folks who I really started a lot of this work with so long ago. In the early 2000s, I remember we were going through the first Sacramento County child welfare redesign. And during that time, I was a young person newly exiting the foster care system, and I wanted to give back. I wanted to be able to share my experience, both good and bad. I wanted to give input about what it meant to be from Sacramento and to really feel and live through these communities. That was really special to me. It was special to me to be able to, little tech moment, sorry. It was really special to me to be able to give back and to give voice. And one thing that was so special is that back in the early 2000s, Sacramento County had over 4,000 young people in care. And today, it's more like 900. And that shift does not come without partnership. That shift does not come without investment. And it does not come from not listening to your community. Sacramento listened to their community. So that work in the early 2000s was not for nothing. We were building those pathways that are going to intersect with that larger framework that we are all committed to today. The framework that involves partnership from Strategies TA, from the CAP Center, from all these different organizations across the state, and that support that comes from the state as well. We're in an important moment. When we talk about our why and what that means, the why is to get us to a system that's here to protect those who are most vulnerable and not to remove children in poverty. Not to remove children who actually will do better in their communities, with their parents, with their families, in their schools. We should not remove children because of poverty, and we know that. And this is the pathway to that. I cannot get over the fact that today, the kids that are in care, yeah, there's still some there who probably should not be in care. But we're taking the strides to make sure that they get back home. They get back to their community. And we're taking strides to really build communities. I love that yesterday I'm sitting in a First 5 commission meeting and I'm hearing about healthy generations. What are we doing today that's going to impact the generations after? I stand before you as a vision. I mean, I grew up in care. My peers have those numbers that we all know that are so real. And with connection and with community and with opportunity, you really can do what you would like to do in your life. It's not just a dream, it's an opportunity. And for me, it started with folks sitting in a room with me, beside me, as I'm probably eating the cheeseburger while everyone else is all quiet and I'm over here snacking in the corner or saying the wrong thing or showing up late. Or as one of my mentors who are actually in the room with us, I remember Kim probably sending a text message or a phone call. Where's the meeting at again? Janae, we're starting in 5 minutes. Where are you? Right? But it's that opportunity to experience that partnership, to have that moment that's really led for me to be here today. And I couldn't be in a prouder position. Sheila Boxley, oh my goodness. Stephanie Beagler. We have folks in the room and we have legacy behind this work. Legacy that saw that we needed both a community partnership, we needed a partnership with the county, we needed a partnership with the state. We need partnership with probation. We all have a moment here and we're taking that moment forth and it's leading us to our future. It's leading us to healthy generations in the Sacramento community and across the state and even nationally. Because our work is so great that it really elevates what's happening locally and the state's here listening. So now we have prevention showing up across the state. And nationally, we see that with FFPSA. The moment is now. Our opportunity awaits us and we're doing the right work. We're headed in the right direction. Let's continue that. Let's work together diligently today. Let's start to form those community partner and pathways, the community pathways that we keep talking about in these plans. You know, let's bring this infrastructure to life because Sacramento to me is a great example of where you can be when that investment happens, when those partnerships are real. And number one, when we center those who are living through this experience. So thank you so much for this time and opportunity. I can't wait to dive into the work with you all today and bring that energy that we need to get us through. But I'm just really grateful to be here and it means a lot. Thank you.
Janae, thank you so much for those amazing words. And yes, we understand the tech challenge piece. Thankfully, you're in a room of colleagues and folks who understand. Wonderful, wonderful words. Thank you so much. And I look forward to working even more with you in these coming years. So we're going to give, I think, a try again to the Mentimeter. And let me see. We can. Okay, we'll have to, there is the QR code there. So if you all can give a try scanning that again. I will also put a link into the chat. Right, thank you. So you'll see the QR code and there's also the Mentimeter link in the chat right now. So let's see, which of the following most closely describes your affinity group you're connected within this work? I see we've got child welfare here with us, child abuse prevention councils, behavioral health and mental health, probation, a lot of community-based organizations, wonderful. Parents and youth with lived expertise, fabulous. Tribal organizations with us today. Amazing, keep them coming in. Go for maybe another 30, 45 seconds. Give folks enough time to scan and do this. I love all the thumbs up. Wonderful. Got some state agency folks with us, education, Yeah, a lot of community voice organizations. That's so exciting. Get some others and we'll have to next year figure out how to break that down a little bit more. We'll see what comes in. All right, wonderful, folks. Thank you so much for sitting with us with the tech challenges. Okay, we're going to go to the next question. Okay, what California county are you located in or representing today? If you can please put your entire county name in, that will be great. Because as you see, the more folks that enter in, it kind of a bigger number, the bigger words are in essence the most people from that particular county. So in the full county name, looks like San Diego, Sacramento, Los Angeles, Contra Costa. It changes so fast. Ventura, Santa Clara. This is so great. It's really helping us to understand who's in the physical space. Yeah, San Diego. You almost have a lot of folks in the room. Amazing. Sacramento as well, Los Angeles. I know there's a big LA group at Magnolia Place. Welcome, everyone. Nice. Keep them coming in. San Bernardino. It's looking like San Diego, LA and San Diego. You all must have a lot of folks in the room. Sacramento as well. Humboldt. Amazing. 363 people so far. Keep it coming. We got public health with us. Thank you for putting that in the chat. Yes, if one of your affinity groups is not listed, we only had I think there's only a certain number of groups we could list. Please put them in the chat. That really is helpful as well. Okay. Keep them coming in, folks. We're going to switch to our next segment, but please continue to have, we'd love to know how many folks we have here today. Love to know who's in the room. First five is with us. Hi, Connie. Mendocino, amazing. Thank you all so much. All right, so we're going to now go into our first county team time segment, which is really exciting. And this will be this is just a recommendation to do some welcoming and setting the stage for today. Your group might do some welcome and introductions, some group agreements, and some visioning for the day. The facilitators and site leads did get an orientation with a guide. So there are some things we recommend, but of course, no matter where your group is, you all know your group best. So I'm sure you'll have a lovely time together for this first segment. It's about 30 minutes. So we will see you back here, let's see, at 10:05. Some county team time reminders. So if your team is virtual or hybrid, you'll leave this main session, you'll click leave and then click leave webinar. Return to the lobby via your open browser, go to sessions and click on your county Zoom session. If your team is fully in person, you can keep this main session open or leave the main session and return when it's time for the plenary presentations at 10:05. Let's see, site leads and facilitators, the facilitation guide is provided. Just put it in the chat again. Please keep an eye on the time, bring your team back to the main session at 10:05. After that, we'll have a panel of peer sharing and some community engagement reflections. So to return to the main session, you'll go to the lobby, again, via that open browser, go to sessions, and then join the main session, and that will be 30 minutes. Some reminders for any tech issues, again, type into the lobby chat, and everybody will see you back here at 10:05. Thank you. Hello, everyone. Welcome back. Hopefully you had some time to connect with your team and kind of set the tone within your group for the rest of the day. Quickly, I'll just ask kind ask to folks. If you're in person in a room and you might be logged into a laptop or another computer, if we could ask you to kindly please log out. If you don't need to, really only the site lead or the facilitator needs to be logged in the in-person room. So if you're logged in and to a laptop and don't really need to be, we ask you to please exit out of the main session and also exit out of the lobby. We've actually reached capacity for today, and so other folks who are trying to join virtually can't get in. Bryn, I'm going to pass it to you quickly to just give some instruction for the hybrid counties for next time.
Yeah, and I'll repeat this, I think, again, right before we go into our next rooms, just in case anyone is not here. If you are a site lead and you were unable to start your hybrid session online, please send a message in the lobby chat. And we will make sure that we have the correct people having the correct permissions so that all of those hybrid teams can get their rooms started. So if you were unable to start your hybrid room as a site lead, send a message and we will get that sorted out. We have to give the right permissions to the people who actually logged on. So if you used a different login to do your live streaming today, you might not have the right permissions to start the room, and we want to make sure we get that fixed before the next one. And another note is that for those of you whose counties do not have a hybrid session and you're not able to attend in person, we will be creating a multi-county discussion room for our upcoming sessions. So we will get that going before the next one, so everyone can participate a little bit more. So thank you. And I'll repeat this once we've got everyone back again, right before we go into county team time again.
Great, Bryn. Thank you so much. And thank you all for your patience with some of the tech-related issues. Okay, so we'll now move into our next segment where you'll hear from several peers regarding their community engagement and community pathways reflections. First, however, I'd like to introduce our moderator for this peer sharing time, Junious Williams. Welcome, Junious. Junious is the principal of Junious Williams Consulting Incorporated, a firm specializing in collaboration, design, facilitation, program, and strategy development focused on increasing equity and social justice. He's worked extensively over the last 30 years on a variety of multi-stakeholder, multi-sector collaborations and collective impact initiatives, providing guidance and support for efforts addressing social issues ranging from full-service community schools to cradle-to-career pathways, from opportunity youth education and to employment to improving outcomes for boys and men of color. He is currently a senior advisor to the Collective Impact Forum and recently co-authored an article on centering equity in collective impact in the Stanford Social Innovation Review. He holds a Juris Doctorate and a bachelor's degree in sociology from the University of Michigan, where he also pursued graduate studies in educational administration. Junious, welcome. So nice to have you here.
Thank you, Sarah, and good morning, everyone. And let me welcome you back to day two. And hopefully your county sessions were productive in terms of laying out the work for the rest of the day. It's my pleasure to moderate the panel this morning. I want to take a couple minutes just to set a little context, and then we'll get into some introductions of the panelists. One of the most important aspects of any type of systems change work is a process of learning and continuous improvement. You can have the best strategy in the world, but if you don't gather data, converse with folks, co-learning from that experience and devote it to improving your practices, you're never going to reach sustainable sort of outcomes. This is especially important when you're involved in a cross-site effort like you are with Family First Prevention, where you're doing cutting-edge, groundbreaking work. There's no roadmap. You're kind of developing the map as you go along. And that makes one of the most important sources of learning and information is peer sharing. So we want to continue today, as you had an opportunity yesterday, to hear from some other practitioners, folks who are doing the same work. And today we've invited folks in from San Diego County and San Francisco counties who will be sharing their stories with you about their prevention planning and especially around engagement. I'm going to ask each of the panelists to introduce themselves in a moment, but first I want to quickly lay out the format for the session. Each of the county teams will have approximately 8 or so minutes to give you kind of an overview of their work. When both of the teams have completed their presentations, we're going to open up the floor for questions and comments from you. A reminder that for questions, you need to go to the question button at the bottom and type in your questions. Some of the staff from Strategies TA will harvest those questions so that when we get to the Q&A section, they can be presented to the panelists. So I'm going to begin by asking each of the panelists to briefly introduce themselves, name your role in prevention planning and implementation, and anything else that you think it's important for the audience to know about you. And we're going to lead off with the team from San Diego, and we'll follow that up with the team from San Francisco. But let's go around and have everyone introduce themselves. And why don't we lead off, if we could, with Laura and the San Diego team? Floor is yours.
Hi, Junious. I'm sorry. The San Diego team's having a little bit of tech issues. Could we start off with San Francisco?
Yes, San Francisco folks, while we wait for San Diego, do you want to lead in and do your introduction, Karina and Seth?
Sure, I think, Karina, do you want to start?
Yes, I forgot to unmute. Hi, everyone. Good morning. My name is Karina Zhang. I am a program support analyst with the Family and Children Services in San Francisco. I have been involved with FFPSA since the beginning of plan development in February 2022. And I'm now one of the project leads to provide oversight for FFPSA implementation in San Francisco.
Thank you.
And I am Seth Kilborn. I am the Principal Grants and Policy Analyst over here at the San Francisco Juvenile Probation Department. I've been here for 5 years now and have been participating in the working group that has been addressing FFPSA issues since it got started. And so, and I represent JPD on that community group.
Good.
And I'm looking forward to talking to people today about our experience.
So why don't we do this while we're waiting for the tech problem to be straightened out with the San Diego folks? Why don't we jump right in and give you some time to describe to folks some of your work, highlighting some of your successes, some of your challenges, a little bit about the context and who's at the table. Floor is yours. Go ahead.
Sure. Seth, I can start us off and then you can share your insight and perspective. So in San Francisco, we were able to get the work off the ground pretty smoothly, leveraging our existing partnerships on the FRC initiative. So there are 2 partners that have been instrumental in making this work possible for us. The first one is the Department on Early Childhood, or DEC, is where our First 5 initiative is housed. They are the grant holder for the FRC grant, and they have been providing a lot of support and technical assistance on amending contracts and budgets to formalize our collaboration with the family resource centers on the FFPSA work. And then the second partner I would like to highlight is our Child Abuse Prevention Council, Safe and Sound. They are the lead on the FRC Alliance in San Francisco, which is a collaboration of all 26 FRCs. And they meet periodically to do strategic planning and advocacy work for our families in San Francisco. So through a trusted partner in the community, like Safe and Sound, we were able to get the word on FFPSA out much more quickly and effectively. And we have like over 30 agency and community partners co-creating the comprehensive prevention plan with us. And that got approved in May 2023. And then 2 months following the approval, we were able to launch the pilot pretty smoothly. And right now we are working with 11 of the 26 FRCs, primarily on building 2 pathways. The one is a differential response pathway that serves families after a child welfare investigation. And then the second pathway is the what we call evaluated out pathway. We try to capture families more upstream. For those who get evaluated out at the hotline, we are hoping to create a pathway to refer them to the community to receive services early on to prevent them from getting to the attention of child welfare again. I am very proud of our partnership with all the agency and community partners. We have like over 30 individuals sign up for this statewide convening this year. Very proud of the partnership, and I want to take the opportunity to thank everyone who stayed on this journey with us. The area that I feel like we want to make progress on in the near future is in engaging parents and youth with lived experience. We have been able to pretty successfully engage them in just consulting, getting feedback from them on the plan, informing them and consulting them, with them. But we feel like it's a challenge to move from simply consulting to actually involving and collaborating with them at the same table. We like to say that we are building the plane as we fly it, but there are certain lives that we don't want to risk or sacrifice easily. And the parents and youth are definitely one of those. So we want to really have a more thoughtful plan before we engage them to come to the table, joining the work group, ongoing with us on an ongoing basis. So I feel like today it is a perfect opportunity. We have a group of community partners here with us today, and we have definitely put down on our agenda to spend a significant amount of time to craft a plan together on the next steps on engaging the parents and youth with lived experience. Yeah, so I know Seth have some ideas about some of the areas that we need clarity on. In the past couple of years, as we get this plan going, we feel like we need more clarity and guidance on certain policies and mandates, and that's one reason why we don't want to just invite partners to the table to just check the box, because I think it's important to set them up for success. We don't want to invite them to the table and not give them a meaningful role, or that they provide some input, but we don't know how to address their concerns because we lack clarity on the mandate. So that's where we're at, and I'm gonna let Seth share his perspective.
You're muted, Seth.
There we go. Yeah, it's really been quite an educational experience for me participating in this work group, because it just tells me and shows me how committed our child welfare agency is to community partnerships, and we have it all kind of built, or it can always be strengthened, but it's there. And it was really a matter of pulling the right people together, and I'm really glad to be part of that group. I think juvenile probation departments are in kind of a unique role in this whole FFPSA implementation, because we're not just another community partner that's delivering services. In fact, we play a different role in sort of this in between. the Child Welfare Agency, you know, HSA here in San Francisco, you know, does an amazing job of, you know, managing all of this stuff. And what we have to do over here at probation is, you know, far simpler in comparison. Having said that, I think that, you know, some of the uncertainties around FFPSAs has been really challenging, you know, particularly, you know, our inability to access the child-specific federal, you know, reimbursements until, you know, we have a system in place to capture the data that we need. So in the meantime, we're kind of, as Karina said, flying. We're getting directions and we're building the plane and flying it at the same time. And the directions aren't complete. Like there's missing pages that we need to have filled in. But what we're doing is, you know, testing out, you know, some of the processes and procedures that we'll need to have in place when that time comes. For a long time, the Juvenile Probation Department has been interested in a MST support system. Sorry, I was going to say multi-systemic. Yeah, multi-systemic therapy is what MST stands for, and it's a service that is you know, on the approved FFPSA list, and so we're going to start testing. We've found a provider, and so what we're going to do now, working with HSA in the committee, is to test out what are the time study or billing and processes that we have to have in place so that when the time comes and the funding is all available, we'll be able to flip the switch, because so it'll teach us a lot about sort of the role of the Juvenile Probation Department. Interesting issues have already come up around sort of the role of the probation officers, who are actually the case managers, and the role of the service provider and how that's all going to work. So it's going to be a great process, I think, to learn a lot from then the provider that we have. Seneca is an expert in Medi-Cal, and we'll probably learn a lot from them too about how to incorporate and make sure that we're following all those rules that FFPSA has put in place for us. So I think FFPSA is such a great opportunity, and it's so challenging to implement because it's big and and we don't have quite all of the information, but I think we're doing the best we can and a pretty good job here in San Francisco of staying on top of all that stuff. And I will stop there and look forward to any questions that people have.
Thank you, Karina and Seth, and we'll come back to you because we're going to pick up the San Diego group, and then once they've given a bit of an overview of their work, then we'll open it up for comments and discussion.
Sounds good.
And San Diego folks and the tech people, are you available now to introduce yourselves, Laura and Sarah?
I think, Junious, they're still having some issues. They're not able to hear or see. So they're not able to hear the audio, or their mics are not working. So we're going to try to see if we can have them call in. We're working on a back end fix now. So San Francisco, excuse me, we'd love to continue with the dialogue with both of you.
Sure. So why don't we go ahead and folks, if you've got questions for Karina and Seth, why don't you go ahead and put them in the Q&A. In the meantime, though, I've got a couple of questions that maybe get us started. Karina, you expressed some concern about there's some unsettled issues, and therefore there was a little reluctance to fully engage families and youth at your current table. So can you talk a little bit more about what kind of engagement and information gathering happened with young people and family members in the planning process, and how do you see that changing as you move now into implementation?
Yeah, so we've conducted a series of focus groups in the community with parents and youth, and some of the input that we gather actually is around, you know, where they like to receive services. So, you know, family resource centers are a good place to start. And then we also, during the focus groups, we also try to gauge how they feel about having this process be, you know, like a process that's being overseen by child welfare. And there will be touch points, you know, with the child welfare system and JPD system. And they, you know, we're getting pretty kind of negative reaction from that, from the groups that we interviewed. Some people expressed that they would not like to access services provided, you know, through the systems, and some people are a little more open to it. So, you know, in the past year, we've been trying to understand what a light touch really means, right? Because I think it could mean very different things from, you know, if you're looking at it from the child welfare perspective, or community partner, or if you're the parent or youth. So that's something that we're still trying to understand and need a little more clarity from, right? Like, for example, with the candidacy determination process, like how it would look like with populations that are a little further away from the child welfare system. Because right now we are focusing on building the pathways for those who have been in touch with the system in one way or the other, because, you know, they're just kind of lower hanging fruits that we want to start somewhere, right? We don't want, if we have everything kind of all figured out before we start implementation, it may, you know, it may just be too long. So we want to start somewhere. And so we're starting with the populations have closer proximity to the systems. And I think, you know, those families would be more, I guess, used to, right, having kind of child welfare presence in the services they receive. But once we move kind of further away from that, you know, we still are not clear on how that could look like or should look like. For example, again, like with candidacy determination, with the risk safety assessment, and also, you know, with the way we are required to collect data and share reports with the state. So just, we would appreciate it, you know, if we can get more clarity and guidance in those areas, so that we know when families raise concern, again, we know how to address their concerns.
A couple of questions did come in for you. One question is, could you describe your pilot project and which populations and how you're implementing it? And then a related question is, how are you dealing with confidentiality related to the community pathways?
Yes, so we are leveraging our existing infrastructure with the DR differential response program. So the kind of the referral pathway and the service infrastructure is already there, because we do have 10 family resource centers serving this population. Well, that's kind of multiple populations on the 14 candidacy populations, but they are, most of them have had at least one investigation at with child welfare, and then it is determined that there will be, those families will be better served in the community. So we're not opening a child welfare case. We refer them to the family resource centers instead. So we're really leveraging that existing infrastructure at this point. And what's the second question? I think it's kind of related. Sorry.
Confidentiality. How are you dealing with confidentiality?
Right. So because they have been in touch with the system, so we know who they are. That's why it's a little easier to implement. Like, as I mentioned, that's why we're starting there. I hope that answers the question.
A second or another question on a slightly different topic is that someone was interested in knowing, how did you advertise for the focus groups to the community, and was there any incentives for their participation? And if so, what funding stream did you use to incentivize folks?
Yeah, we actually did that through Safe and Sound Child Abuse Prevention Council. And then, you know, many of the FRCs also have parent advisory boards, and we definitely have resources that we can tap into to reach out to those groups. And we did provide a gift card as an incentive for participation. And those were paid for through, we have state block grants that we could utilize, and there's also some FFTA funds that we're using to support our project or initial implementation.
So one of the things, Karina, that you mentioned in your presentation that struck me as noteworthy is this notion of when you described what was done in the planning process, you described it as consulting with the community, and you distinguished that now you want to collaborate with the community. Could you talk about what's going to be different in your practice as you try to move from just consulting the community to actually collaborating?
Yeah, so I see that as having them at the table with us on an ongoing basis, like joining work groups, having like consistent participation. We do have, we have 2 peer parent programs in San Francisco, and they're kind of within our network of partners that we have engaged for the FFPSA effort. And then we have parent advisory boards with some of our FRCs, and they also have like parent mentor programs. So I'm confident that we have a pool of candidates that we can recruit from. And if we want to just have a body at the table, we certainly could have done that. But again, like I feel like we need to have a better plan in kind of helping them orient to this process, provide them with adequate training and tools so that they can participate meaningfully. It is not always easy to sit in these work groups because, we actually share a large amount of information. It could be overwhelming, and sometimes it could be intimidating. It took me a long time, to really understand like what we're trying to accomplish myself, so I can see how, we don't prepare them. It just won't be a good experience for them. And I would hate to break that trust, with anyone who, parents or youth who come to the table, especially. So, yeah.
So the other question, oh, no, there is another question that's a couple here. Let me go to those. Someone is asking a question, Candace Seagrove is asking, they're wondering about if the referral process moves one way from child welfare to the CBO, has there been exploration of if the referral can come from the CBO to the child welfare agency and identifying a family who might need prevention services but hasn't gotten to the hotline's attention?
Yeah, that would be more like phase 3 in our plan. So right now, again, we're not there yet. The short answer is, but it is, that's definitely our vision, is to be able to get to walk-in clients for the family resource centers as well, eventually, general public who can just walk into any family serving agency and be able to access prevention services. That will probably be some years down the road, but it is definitely our vision.
Someone else is asking, what's the client engagement rate for your community pathway pilot?
So we are at a point ready to collect data from the family resource centers. So unfortunately, I don't have the answer to that question yet. Hopefully next year, if I come back here again.
Okay.
And Junious, I'd like to just share, we have the San Diego folks on. They made it. Welcome, San Diego.
And how do you want to manage time, Sarah?
Yes, we're okay to go over until 10:45.
Okay. So thank you, Karina and Seth. And I'm going to switch over to our colleagues from San Diego to give them an opportunity to introduce themselves. And after you've had a chance to do that, why don't you move right into kind of describing your work to folks?
Good morning, everyone. So sorry that we're jumping on late. We've had some tech issues back here. I'm Laura
So at least on my monitor, she's frozen.
Yes, mine as well.
Okay.
Yes, and Twelme. Maybe we'll take another question, Junious.
Okay, and let me jump back over to the Q&A. Give me a quick sec here. Yeah, this is an interesting one from an anonymous attendee. As someone with lived experience, I was asked to join groups that had to do with the department while my case was open. Do you not think social workers can determine a parent they know that can provide great insight, a parent with a current open case? We're going back to you, Karina and Seth.
That's an interesting idea. We will certainly talk that through today at our meeting, and I want to hear what our community partners who work, more closely with our families think about that. Any thoughts, Seth?
Well, yeah, I think I would need to talk to my probation officers about, how that might work. Since I'm sort of separated from, on the admin team to the extent that, I'm participating with someone who might be involved in the juvenile justice system, that's fine. If with an active case, I mean, obviously that's a different story if it's not. Because the probation officers aren't as directly involved, so it might be possible, but that would be something we'd have to work through for sure. Although we are committed absolutely to getting, input and feedback from justice involved families, wherever we can. So we have a lot of new programs going on over here, which is a whole separate story. But so we've been trying to engage quite a bit with youth and families who are engaged with the juvenile justice system here in the city. An interesting idea though about that, because I think it really does prevent. Isn't it funny, right? Because like one of the big challenges is this confidentiality thing. Like you want to deliver prevention services, but in order to do that, we have to collect all this data, and then that makes people feel like they're becoming part of the system. And for JPD and for child welfare, that's a problem. That's a challenge. So how we get through that would be helped by, I would think, people who are, actively involved in either one of those systems, but it does pose some potential conflicts that we have to work through.
Yeah, and this seems to be a question because that person and other folks are really concerned about the confidentiality. How about those who have not been touched by the child welfare system and the confidentiality issue with them? Yeah, that's
the big one. It's like, because we're trying to deliver prevention services, which means that we're trying to prevent their involvement from any involvement in either system. But in order to do it, we have to can feel like to them, I'm sure, like they are becoming part of the system, even though we're trying to prevent that from happening, because we have to engage and collect the data that the FFPSA requires. I mean, it's a real, I don't know, maybe I worked for HIV and AIDS programs for many years at the federal level, and like we avoided like these kinds of data collection issues for this very reason. It was a long time ago, but still the confidentiality issues are really a problem when you want to deliver services that require that kind of data collection. It's a lot of money involved, blah blah blah. It's a real challenge. And for this is the only federal program that I know of that is like, it's an entitlement program that is allowing dollars to be spent on services, which is another bridge maybe that this law has made, because I don't know of any other federal program that does that, which creates complications because it's individualized services that you're delivering. So.
Well, if I could, though, I think that one of the things that this whole line of questioning is raising, when you change the composition of who's at the planning and decision-making table about prevention planning and implementation, you've got to look at your business rules around the data to create opportunities for those folks to fully engage in the information that's available to make good decisions. And oftentimes we don't, and then we hit these impasses that, oh, we've got somebody at the table and we don't have business rules that spell out the boundaries of what can and cannot be shared with those folks. And that's especially important because when you're bringing in kids and families, they're already a little shy around the table, and now you're hiding information. So I really strongly counsel people, if you're going to integrate folks in, sit down with your data people, sit down with legal counsel and figure out what are the business rules around data sharing that apply when we have these sort of mixed collaborative groups, kids and parents and CBOs and non-agency staff. So that's just a general recommendation to everyone so that you don't end up with a problem down the road where you've ended up disclosing something that was confidential.
Junious, we do have San Diego back on, and I think they're just going to stay off camera if we'd like to give them a few minutes. Thank you.
Sure. Why don't we go directly to them right now?
Hi, it's Laura Kraswicki again. So I'm just going to quickly highlight some of our partners in our prevention work, and then Sarah's going to go over what they're doing now to shift towards implementing our county prevention plan. So as I said earlier, just thanking the 80 people that are here with us today in person. We really appreciate the time that it took for you to come here. Also wanted to highlight in our prevention work, our partners in prevention team. So it's systems level coordination of services and partnerships to support families with children between the ages of 0 to 5 to strengthen protective factors and align community-based prevention services to really reduce the likelihood of child maltreatment. So that's led by the YMCA team here in San Diego and many other cross-system partners. Also our FFPSA pilot sites. So they are longtime partners supporting families in the community and have been working closely with our team and contracted partners and ICF in capacity building for FFPSA provisions. And then also thanking our tribal partners that contributed to the development of our county prevention plan. We have our Indian Health Council, Paula Social Services, Santa Isabel Social Services, Southern Indian Health Council, Sequan Family Services. In addition to our tribal partners that are here with us today, last week, several of us had the opportunity to visit the Paula Reservation, and during that time, we were able to hear from our local tribes and hear about the work and prevention efforts that are happening in the communities. So we are really inspired by the prevention work that's already happening. And then lastly, just wanted to thank our youth and families with lived experience that really helped highlight our prevention work as well as our internal staff with lived experience that contributed to our prevention work as well.
And I'm going to jump in with a little bit about how we've started to implement our comprehensive prevention plan. And what we've done is a lot of focus with our contracted partners to look at capacity building through work looking at current infrastructure within our county and seeing what is needed for us to be able to expand services to other families. And what we're doing is we're looking at a lot of data to inform the capacity building and the decision making. We're looking at who's eligible for what evidence-based practice. And right now we're currently starting with functional family therapy, and that's primarily with our probation department piloting that, while we are also piloting a new program for parent-child interaction therapy. And what we're doing is building a prevention hub here in San Diego County, and that's our county's primary prevention pathway of no wrong door services that is going to connect family to our community partners. And the family will be referred to a prevention hub either by the child abuse hotline, a social worker, community member, self-referral, or anybody in the community. And with that, the family will be provided with a care navigator who will complete an assessment and connect the family to the appropriate community-based services. And so we're just working on building that out right now. And we're also working on messaging to our staff within our department. And we're doing that through trainings and leadership summits.
Wonderful. Thank you. I know we are at time, unfortunately. We're at 10:45. We have so many wonderful questions in the chat. My hope is that, maybe we can work with our counties that are here today to get some of those questions answered and then present them back to the group after the event. If that would work for you all, we can talk offline, of course, about that. And just thank you all so much for the incredible discussion. And again, I wish we had some more time in this portion, but no reason we can't bring you back later on if that would work for you. So Junious, I'm gonna turn it over to you for a little bit of, and we have about, I would say probably 7 minutes for this section or so.
Have about what?
About 7 minutes.
Okay. Give me a quick second to change here.
Yes, take your time. If it would be helpful, I can give a little bit of information about the self-assessment guide.
Okay. All set?
Yes, I'll give a little I'll give a little information about the self-assessment guide. So your facilitators and site leads already have been to a facilitator's orientation, and that orientation covered what's called the CPP team self-assessment guide. The purpose of the guide is to support your action planning around community and tribal engagement. The questions and activities aim to help teams enhance and go deeper as it relates to community and tribal engagement in planning and implementation. So for the purpose of the guide, the term community in broadest terms refers to parents and youth with lived expertise in family serving systems, community-based organizations or family resource centers, and community members and leaders. So the guide and activities within can assist with identifying a direction for your county activities. Excuse me. But just to note, today is intended to be a time for moving the work of your team forward in whatever way best fits where your group is. And so groups are not required to use the tools that we provided today. They're just a recommendation should you find them helpful. All right, Junious, I'll turn to you.
Thank you, Sarah. I'm going to really quickly just make a couple of context points and then quickly run you through the guide. There are three really important intertwined concepts when you're trying to do this sort of social change. One is collaboration. And the quick and direct collaboration is no single organization can solve these big social problems, and we need to stop doing that. You got to collaborate. Secondly, because we have a history of discrimination, you cannot solve most of these problems if you don't deal with equity and repairing the injury that has been caused by our patterns of discrimination. And then finally, you can't do without community engagement, because no matter how many degrees we have or how many years of experience, we do not see the problem from the perspective of the intended beneficiaries and those with lived experience. And if we don't loop them in and engage them in the problem solving, we're never going to find the right solutions. So that's the sort of trifecta. You've got to collaborate, you've got to look at equity, and you've got to really engage the community. All of that, though, is around outcomes, right? We're not doing this because it looks good or it feels good. We're convinced that if we engage people, if we address equity, and if we collaborate, we're going to produce better outcomes for kids and families. So one of the things, I do a lot of work with folks on community engagement, and we've kind of called several tools for you to use. And I want to just really quickly highlight those. The first tool is from a colleague of mine at the Collective Impact Forum, Paul Schmitz, and it's a community engagement toolkit, and it is a powerful and useful set of tools to really help you as a group process through and understand how you want to do the community engagement work. From that basic tool, we've developed a couple of assessments, right? A more comprehensive assessment tool, and you have a full version of that. And plus you've got a snapshot, a one-pager that kind of highlights the domains of assessment and some assessment questions to get a quick snapshot today. And essentially what you have in this toolkit is on the first side of it, you've got the domains, and I'll run through those in a moment. And on the back side of the snapshot, it connects you to references in the toolkit to relevant material related to that particular domain. So if you're struggling or you've got a problem or you haven't accomplished what you want to in a particular domain, if you'll look on the back of the snapshot sheet, it'll direct you to which area of the toolkit might provide you with resources so you can dig a little deeper into that particular domain. So those are the kind of 3 tools, and all of the documents are linked, and I'm going to really quickly run through. But a quick note, because I go into a lot of situations where people are working on engagement issues, I need to be able to quickly kind of assess the situation so that we can figure out what we want to work on. So that's in part what's reflected in this snapshot and these sort of assessment questions. And there are several areas really quickly that I want to do. The first thing that I see is are people clear on what the purpose and results are that they're trying to accomplish with community and or tribal engagement? What are you trying to get done through engaging the community? And as you see here, a couple of questions. Have you identified a specific purpose and goals that are going to guide the work that you're going to do, whether you're in the community or whether this is around tribal engagement? So the first thing is, do people know why they're at the table and what they're trying to accomplish? Secondly, I'm going to look at representation. Who's at the table? And do we have a diverse set of actors that are going to let us really surround the problem and understand it from every perspective? And this is not only technically who you're required to have at the table. We know that you have in the all-county letter some specifics. But what this is asking is, you've got experience there. Who isn't at the table that needs to be there, regardless of what the requirements are? In the conversation yesterday with the tribal panels, one of the things that they talked about was unrecognized tribes. Not a requirement, but you know from the landscape in your community that those are important stakeholders and actors to have at the table. A clear scope of work, results and outcomes, and who's responsible for making decisions. A lot of times I go in and it's all confused about who makes decisions and what are the results and outcomes that the group is trying to get accomplished. The fourth dimension is orientation and capacity building for participants, especially when we're bringing people from all different sort of organizations and different experiences to the same table. It's absolutely critical that you orient people, that you make sure that they have the skills and understanding of the work so that they can be effective participants there. And I want to make one point. We heard a lot in the last panel about the need for orientation and capacity building for residents and young people. Don't underestimate. There's probably a greater need for capacity building with your staff and bureaucrats, right? Because kids and families, they've learned how to deal in these situations where they lack power and influence. Sometimes some of us haven't. So when we're looking at and casting who needs to be supported and oriented in the process, it's not just kids and families, it's really everybody around the table has those sort of needs. Qualified staffing and support. A lot of times I go in and I watch and observe and I say, quite literally, how in the hell did that person get assigned that responsibility? It's sometimes clear that that person doesn't want to be there, isn't the best suited person for that kind of work. You need to be careful. It's not positional. This has to do with experience and a desire to want to work with families and communities and young people. Effective meetings is the other thing that I run into. I go in and they say nobody comes to the meetings anymore, and you start asking what you're doing in the meetings, and it becomes clear. Meetings have to be not only effective and inclusive, they've got to be around producing results. And give me just a quick thing. This inclusion versus belonging is a really critical distinction. And if you haven't picked up on the nuance going on between those two concepts, you need to. Really quickly, I'm having a party and I invite you to the party and you come to my party and you enjoy it. You've been included. But I've decided when the party is, where, the music, the food, who else is going to be there, decor. I've decided everything. I've included you, but are you there and feeling comfortable? No, you're not. The difference is to get to belonging, you've got to invite people to a table and relinquish control and co-create the reality that's going to be at that table. That's what gets you to belonging, that people have a sense that that is working for them. They've had some say in it. And what comes out of that is something that they can own. And then finally, data, learning, agenda, and continuous improvement. You've got to be data-driven in this work. And plus, you've got to have a learning agenda. You're trying all of these new things. You need to be very conscious of what data and what learning agenda do we have so that you can accomplish continuous improvement. So that's what these particular aspects or domains are about. And I need to jump in to give you time, but I wanted to go through those. And again, the context. There may be other questions driving you already. And if that's the case, jump to what are the driving questions for you. But if you don't have those, here are some to sort of get you started. So with that, I'm going to turn it back to Sarah, who will give instructions for the breakout.
Wonderful, Junious. Thank you so much. I'm going to cover this piece really quick because I think you all have some great facilitators and site folks who can help you through this process. So just to reiterate, the next portion of today's agenda is an opportunity for counties to reflect on what Junious just shared, also to reflect on what was shared on day one in the tribal panel and some of the other discussions, so you can move forward your tribal and community engagement. We put together those activities in the guide that will help you take stock of your own engagement efforts, including those successes, challenges, and those priority areas for action. If they're not already in the chat, I know the team is going to put both the self-assessment guide and the facilitation guide in there. And if we could go to the next slide, I'll give an overview for the day. Okay, so we're a tad bit over, but I hope that's okay for everyone because I think it was really important to both hear from San Diego, San Francisco, and Junious more. So we're going to go into county team time now and get started. Again, if your team is virtual or hybrid, you'll leave this main session and return to the lobby via your open browser. Go to sessions and then click on your county Zoom session. If your team is fully in person, you can keep this open or leave the main session and return when it's time for plenary. Site leads and facilitators, the facilitation guide has been provided, of course. And for questions around the activities, please come back to this main session for assistance. If anybody needs help, please return here and we can support you. So there'll be lunch and you all, site leads and facilitators, you all can decide how you want to do it. If you want to make lunch a little bit shorter to allow for more time for your team to talk, or you can stick to the times that we have here. It's completely up to you. Either way, we're just asking folks to return back to this main session at 1:20 p.m. So your site can completely figure out what works best. And just a few reminders, 1:20 to 1:40. The afternoon Q&A session will be with Junious. That'll be our part one. So please asking folks to put your questions in the chat around community engagement and return to the main session. And for any tech issues, of course, type into the lobby chat. So on that, we look forward to seeing you all back here at 1:20 and have a fabulous discussion time with your team. Recording in progress. Hi, everyone. Hopefully you are back from lunch and had a nice break and time to check in with your team and just have some more informal conversations. So welcome back. We'll probably give a minute or so for people to come back in, and then we'll get fully started.
Just a note as we're getting started that it seems like the lobby chat is no longer popping up for some people. If that is the case for you, and you have any tech issues, we will be monitoring the webinar chat. So feel free to send us any questions in the meeting chat. And we apologize for the inconvenience.
Oh, thank you, Bryn, very much. Yes, and thank you all for your patience as we've navigated this new platform. All right, so welcome back. Hopefully you had a nice lunch. For our next portion, we're excited to bring Junious Williams back, and he's going to spend some time answering questions around community engagement that have come in. And we're also encouraging people to please put any additional questions in the Q&A box down below on your toolbar. So love to have those come in as well. Junious, welcome back. Hello.
Thank you.
So we had some questions come in, I mean, I would say since registration even. So I'm going to read these off, and yeah, Junious will give us some great responses. So one of the ones that came in is, our comprehensive prevention plan has been approved, and we've noticed a number of partners have left the collaborative table. So how would you recommend re-engaging community partners and lived experts to revitalize our group for implementation?
Well, I think the first thing is to recognize that you're in a transition period and you need to step back a moment and do some additional planning. And I say that in the context of the way that you organize yourselves in doing planning may well be different than the way you need to be organized and what you need to do at your meetings when you're in implementation. And a big issue is, how do you organize yourselves in terms of doing the action work? So one of the ways that I typically look at is organizing people around strategies, because usually folks have identified 2 or 3 broad strategies that are the core of the work that they want to move forward. So what I recommend oftentimes is looking at those, and if it makes sense, to organize the implementation teams around the strategies. So that's one thing, is how do you get organized? And the other thing is, do you need committees beyond sort of the strategy to do support work? One that is typically needed is a data work group to really infuse and organize and coordinate the data that everybody needs to move the work. There may be others. So for example, one might be a committee. If you're experiencing attrition of folks around the table, you might want a recruitment and engagement committee, right? Somebody who's going to take responsibility for making sure that new people are recruited and welcomed and inducted into the process, so that you're strengthening that team. The other thing that I would say is recognition that people are in different spaces, that probably people who like planning dominated the planning, and now you're moving to people who are action oriented. My thing is, you need to figure out how to run parallel tracks on both of them, right? So that people have options. If I'm tired of talking about stuff and I need to get concrete and do something, where are the outlets for me to do that sort of thing? I want to get action. I want to get my hands dirty and do something around getting the strategy implemented. So it's just a recognition of stepping back and asking people, what do you want to do now, right? And creating your structure around making sure that the structure is responsive to the kind of work that people want to be able to do. So that's the biggest piece of it, figuring out what do we need and how do we organize ourselves for the next phase of work. The final point I would make is expect attrition, right? These collaborative processes are full of attrition. People get promoted, reassigned, people get tired, families leave, all sort of things. So you're in a constant state of having to induct and orient people. Just build an infrastructure to do that really well. That's why I'm saying, do you need an engagement and recruitment committee, so that you've got a group of people who are taking responsibility for making sure that folks are ready to do the work? I'm stopping there. I can talk.
I love that idea. It's so true, right? It's just, it has to be a constant flow of people coming in, a constant flow of getting them oriented and prepared. right? Because you know people are always going to leave. It's kind of ever evolving. Yeah, thank you for that. And folks, again, just a reminder, please put any questions you might have in Q&A. Okay, this is, I really appreciated this question. The next one, we feel like we've messed up or come up short with both community members and those with lived expertise and really want to repair those relationships for our plan implementation. Any recommendations you might have?
The first thing is, if you ain't making mistakes, you ain't doing the work. We need to get more comfortable with a couple things that and I've always said this, not everyone agrees with me. I learn more in failure and mistakes than I do in success, right? And I just have to get comfortable with that. I often say to people, because one of the big issues here is being honest and transparent. And if you're trying to get everybody working together, there's sort of collective responsibility for success and for failure. And that needs to be inculcated into the culture of the working group, where people will say, you know, I thought this and I did that and that was mistaken. And everybody say, well, what do you learn? They don't jump on you. I say to people, especially around data and the learning, we've got to move from a mindset, because the historical mindset around all this data that we want you to bring to bear to the process is data means I got you. Somebody's going to look at that data and say, I got you, you didn't do something. And my approach is, no, we got to move from data being and learning being about gotcha to being about I got your back, right? That, yeah, we're all screwing up, and you can find a million screw ups in my history, but that ain't the point. The point is, what did I learn and what am I going to do differently? And you've got to incorporate that into the culture of the group, where people readily admit that I thought it was this, it was that way, I made a mistake here, and people saying, well, how can we get you back on course? What do we need to do differently? And for me, that's the most important part of this, is to try to get that established in the group. The other thing that is so important is go and engage with the people that you think you've done harm to, right? We can sit in isolation and worry about what we did wrong and all of that. The best thing to do, and what gains respect, is to go into the community or whatever group and cop your plea. We screwed up, right? We had one or two family members at the table and it wasn't enough. It isolated them. It wasn't productive and stuff. So can you help us figure out how to do this right? People appreciate that. We're talking all this stuff about lived experience and lived expertise, but we don't practice it in the way that we do, which is we got lived experience and lived expertise. Going to them saying, how in your community do you run meetings that keep people engaged, and learning from that? There's this whole round of just like with the people that you're trying to make amends with, that who thought you offended. The first thing is admit errors and stuff. People appreciate that. They know you've committed the error, so they're watching to see, is he or she going to cop the plea, or are they going to avoid it and evade it? And that they draw many inferences about who you are as a person. So my thing is that if I screwed up, I go in and say, I'm sorry, folks, I screwed up. This is what I wanted to do. This is what happened. This is what I think is better. What's your reflections on that? Or if we've not done something in the process, we did it wrong the first time by not engaging you. We ain't going to repeat the same mistakes twice. And so help us to figure out how to do this, how to engage you, what would make good for you. A couple of things that people mentioned yesterday in the tribal panel that are really compelling to me. We expect people to come to us, and we shouldn't do that. We should start any engagement process by going out to the community, going and asking to be in their spaces, going to their meetings, asking them where their success is and how they engage people. That whole process of not starting out like we are the experts and know everything. So for example, a lot of times when I'm trying to work with a group, I'm saying on a problem, I go in and I say, what are you already doing about the problem? What are your solutions and how can we help you on your solutions? Because communities are working on these same problems. They might not prioritize them exactly the way that we do or assess them, but they're concerned about every issue that bureaucratically we're concerned about. But we've got to honor and value what they bring. Where did they start on the problem and why and with what? Because that's reflective of a lot of that wisdom that they bring to bear that we say that we want to exalt in the process. You got to show that by saying, let's start with where you are. And the other thing, and I'm going to respond to one thing quickly, we go back and forth of all wisdom is with the community, ain't no wisdom with the community. We sing the pendulum back and forth. It's about equilibrium. People and residents and young people know stuff that I will never know. I did not grow up in the technology age, so I got to listen and learn from them. But by the same token, there's some stuff that community doesn't know that I don't know, and they got to value and honor that. It's striking the balance. We got all this knowledge and wisdom. How do we bring it together and get the synergistic effect to understand what's going on and to understand what we need to do about the problems we're trying to attack?
Absolutely. I love the culture of learning, right? I think that's so key in groups, and it's excellent modeling when you have folks saying, I messed up, you know, I can do this differently. We're not going to repeat these mistakes. Excellent model. Thank you, Junious, very much. Let me see, what are some of our others coming in? Okay, so here's another one that came in. Several community members in our group have shared they feel intimidated by being with so many agency leaders and often don't understand what's going on in the group or feel valued. What practical steps could we take to turn this around? I appreciate that question.
Well, the first thing is going back to the comment I made earlier about the difference between inclusion and belonging. And one of the best things about being in a collaborative process is that you've got 10, 20, 30 people, all from different organizations, different culture, different rules of practice and operation. Everybody is coming into the room with an expectation that this is a new environment and some things are going to be different than what I'm accustomed to. Great fertile territory for building the new culture if you're deliberate and focused on actually accomplishing that. So one of the first things is to get people together and say, what are the things that we need to do to make you comfortable and welcome and a full contributor to the meetings? What are the kind of things? Prep, ancillary things, getting you to the meeting, support, everything is on the table for us to construct a way of operating that invites everybody to be a full participant and be their best selves in the process. So that's number one. Number two, this issue about composition is important, right? When you've got a big 30-person committee and you invite one kid and one parent, boy, that's crazy. I go to the opposite extreme more recently in my practice, where I'm asking people put together a majority resident and young people committee, right? The first thing you do, because people assume we're going to be voting, is to say, oh, this is a little different. There are more of us than them, right? That's the first thing around the balance, right? I don't go in, I don't want people to do voting because I want to teach them how to build consensus and not just vote, because that can be divisive. But we're building then, we're building a process for folks to be able to come to the table, to not feel isolated, to help to build the rules and the routines of the group and to establish the culture for the group. And all of those things make people feel a lot more comfortable. One final thing, and people don't like this, which is yes, well, 2 points I would make. One is the only people are residents and young people are not the only people who need support. Most situations, we need to do a lot of training with staff that are supporting it about getting them to behave appropriately and to begin to relinquish and share power at the table. But what I'm also aware of is, depending on where the community is, when I used to do a lot of youth and family engagement work early on, that we had to run parallel process. It was labor and cost intensive, right? We would have, with all the young people, we had a pre-meeting and an after meeting. A pre-meeting, so they were all comfortable with what was going to go on. They had talked about it in their own language. We had briefed them on it. They go to the meeting, they do the work and stuff, and then we come out and we debrief them so that they feel comfortable. We did that with parents and adults from the community. But what did we do? All of a sudden, we went from one meeting to 6 meetings, right? Right, to accommodate all of the needs. It was labor intensive, but what we did is we built their capacity to feel comfortable and effective at those tables. And as I mentioned before, we also had to do some work with the bureaucrats. As you ain't in charge. There are other devices. Really quickly, one, matching people at the table. Yeah. If we're going to build social capital, one of the things that is a benefit of doing all of this is residents and line staffers and others should be able to build social networks, right? And you can structure that in. So it's not uncommon to have a practice that every bureaucrat gets matched with a family member or a young person. They're expected to touch base between meetings, and they're expected to develop a relationship where if I'm not understanding something about what's happening in the community, I can call my community friend and have them guide me through it. If I'm a community person and I don't understand some of this bureaucratic stuff, I got a partner who I can call on. They're going to build relationships. And if that works at some point, like the things in San Francisco, I'm blanking on the name of it in our article. But anyway, the head of of health services with a pregnant woman, mom, paired, she's not got some social capital. She knows the head of one of the largest bureaucratic organizations in all of California, got his number in her thing. That's building social capital. It's not only what's happening in the meetings, it's what's happening at other times. What do you want to do with your family? What are my aspirations as a bureaucrat? Getting out of that. A lot of stuff you can do to build people's confidence that we're all sort of the same on one level. You know some stuff that I don't know. I know some stuff you don't know. I have. All of that sort of stuff gets surfaced and people build lasting relationships.
That's such a great idea. That's such a great idea. I want to say, folks can always chime in the chat. I want to say that that's part of the Sacramento team structure, is to pair people up who might not historically be paired up together and give them some time to get to know each other, talk with each other, and support each other. I think that's a really, really great idea, really cool model. Yeah, thank you. All right, we have, let's see, we have another question here. Kind of speaks a little bit to one of the others, but attendance at our group meetings has fallen off dramatically, and those who attend don't really seem to be engaged in the meetings. What can we do to increase attendance and engagement in the meetings specifically?
One of the other things that I should mention is keep in mind that you've got a couple things going on. The primary focus is how do we do effective prevention to keep kids out of this monster of an abuse and neglect system that we have. But also you're building an infrastructure to work collaboratively across a number of different interest groups within the community. It's really important that you're evaluating and assessing both of them, right? that what you're doing in that strategy and the impact on the population, but also you're building a collaborative infrastructure and you need to assess. That's all getting to the point. The first thing I'm going to do is ask people why they're not coming to the meetings anymore and what we can do to rekindle their interest or spirit and listen and act on that, right? And again, that's part of the general thing. You're building this infrastructure and you've got to nurture and care for that and make sure, because if that infrastructure ain't working, your strategies ain't going to work, right? All of that infrastructure is incidental to being able to implement effectively a strategy. And if that infrastructure of collaboration ain't working, your implementation ain't. So spend some time, talk to people, make sure that you're nurturing and caring for this collaborative structure that you've been building, because that's what's going to help you sustain and drive the work.
Absolutely. Thank you so much. That went by so fast. We're already at 1:40 to transition to our next segment. Perfect. That was perfect timing, Junious. Thank you. Really appreciate that. All right. I know we had a couple of questions coming through the chat, but maybe we can collect those, Junious, and send them to you, similar to how we wanted to do with the panel earlier this morning, and then get those responses out to folks.
Will do.
That would be great. Thank you. All right. So we are now into our next county team session, which is intended to help your group create action steps to move your engagement work forward in a very practical way. We also encourage teams to set aside some time towards the end of this 90 minutes here to share reflections on the day prior to wrapping up. So just a few little recommendations here, right? Developing some action steps to move your community and tribal engagement activities forward. Who's going to do what when, right? So really getting concrete about it and doing some reflections for, some teams may also still be in the process of discussion from earlier before lunch. And so, of course, you're welcome to continue those dialogues too. It's, of course, up to you what works best. So we will, next slide, go through a couple of reminders. So this will be from 1:40 to around 3:10. Again, you'll see if your team's virtual or hybrid, leave the main session and return to the lobby, go to sessions and click on your county Zoom. If your team is fully in person, you can keep this open and return when it's time for the plenary session or leave the main session. Site leads, you have the facilitator guide, and please bring your teams back at around 3:10. And for any questions about the activities, come back to this main session for assistance or stay here if you have some questions. After that, we're going to go into our afternoon portion until 3:25. We'll have a continued Q&A session with Junious. And additionally, we'll add the CDSS, California Department of Social Services, or CDSS, to the conversation as well. So again, to return to the main session, go to lobby. I think you guys are getting it. I've seen people coming back and forth. And please place any questions that your team might have around FFPSA, FFPS, Comprehensive Prevention Plan, and our community or tribal engagement in the Q&A tab. So you might spend some time in this 90 minutes thinking about what questions might we want to ask to Junious and CDSS in this next portion. For any tech issues, I know the lobby chat was having some issues. So for our tech team, I'm not sure if that's resolved just yet. And for folks coming back here at 3:10. So you can always put any issues in the chat here if you can't make the lobby chats not work. Hi, everyone. Welcome back from your county team time. We'll give about a minute or so for folks to come back on, and then we'll get started. All right. Well, welcome back, folks. Hopefully you had a nice time with your team, got some activities going or action plans, and we're excited for the next segment. So when the tech team is ready, wonderful. I'll wait till we have Cheryl and Junious up with us. Hi, Cheryl. Good afternoon.
Hello.
Hello. And there's Junious. Beautiful. Well, it is my pleasure to introduce our next speaker, who many of you may know. She is Cheryl Treadwell and has 22 plus years of career experience working at the Department of Social Services in the Children and Family Services Division on several programs and initiatives that impact providers, resource families, foster youth, and tribes. In April of 2021, she was appointed the Chief of the Safety, Prevention, and Early Intervention Branch, which is organized to focus the state efforts on the front end of the child welfare system's continuum, including primary prevention. Her education spans both the social work and legal field, along with her extensive experience working in the community and in human services for more than 30 years. Ms. Treadwell has represented the Department of the California Behavioral Health Planning Council, and the interagency is currently co-leading the division's racial equity work group. Cheryl has worked closely on several initiatives over the years, such as wraparound, systems integration, advancing the developmental screening of young foster children, continuum of care, working with tribes, and implemented California's first federal child welfare waiver demonstration projects. Welcome, Cheryl.
Thank you for that introduction. I have to say that these 2 days have been remarkable, and you are to be commended for the work that you've been doing in these work groups. I've had an opportunity to pop in and out of some of the groups to hear the work that's been going on at this point. So at this point, I just wanted to also just say a little bit about what I heard this morning. I just want to appreciate, even for the state, to take away some learning pieces from what Junious brought to the table in terms of not being able to do this work alone, or making sure that we see the problem from the perspective of those with lived experience that also applies to the state when we bring people to the table. And how, as a state, we're able to bring and build social networks too. As bureaucrats, it's our job to also think of that. And as we move forward with this advisory and FFPSA work, that causes me pause to think about how we bring people to the table to advise and assist us with this work from the state level. And I had the benefit of being in the last session with the mixed counties, which included a few tribal reps, to remind us of the importance of bringing that historical perspective to the table at every chance and opportunity we get, to remind people of why we do the work we do and why we need to engage the communities that we're trying to serve here, especially the tribes. So at this point, I think are we doing the slide presentation first or the Q&A session first?
Yeah, we'll do some question and answer.
Okay.
And Junious, welcome back again. Nice to have you with us. So we're going to start with Cheryl. We've had some questions come in for CDSS throughout the 2 days, and thanks so much for being here to answer those. So one of the first questions that came in is ACEs aware, connected with, or being coordinated with FFPSA? How are they linked?
So as you know, Director Johnson mentioned yesterday in her welcome address, she mentioned a project called California Essentials for Childhood Initiatives. And it is an initiative that we do with the California Department of Public Health. It is designed to raise awareness around the ACEs aware and importance of that program. We are not specifically coordinating work with that program, but we are just beginning to acknowledge the counties that are including ACEs work in their FFPSA planning. And in some of the other prevention work that they're doing, that we'll be collecting data around that, and it will be able to give us a chance to see once everybody's aware of ACEs, but what you do with that information once you get it, what happens? And so that is something that we're taking a public health approach to, and with our partners to see how to lift that up with FFPSA. We're just hoping that it creates a context to use the data to inform your actions in your FFPSA work. I think we'll be providing a link. We should have a link to the Essentials website, and it might also give you more information about how that connects to the foster care work too as well that we're doing.
Wonderful. Thank you, Cheryl. And thanks for dropping those in the chat. Super helpful. We have another question here, and I'll also encourage people as we're kind of going through the questions that have come in already, please feel free to also include questions in the Q&A box. If we have some additional time, we can check in with Cheryl about those. So another question that came in is, to engage parents with lived experience, systems need to shift the lens and be okay with sharing power in decision-making. This takes building capacity to start shifting the status quo and building a new culture of partnership. Otherwise, it will not be sustainable. So how is the state encouraging the county systems to shift the lens and mental models on how to engage differently with tribal and lived experience folks?
Well, we required, at least in the CPP plans, that counties would indicate what their engagement strategies, if they knew at the time what they were, to put those into their plans. But we are also, as a state, we've been providing, or if it hasn't been provided, we are providing what we call training, tier 1 training that's foundational around how to make the prevention mind shift. We recognize that the nature of the workforce may need to shift. What does the prevention worker look like? The social worker these days may entirely look different than what they did 20 years ago when I was a social worker. The things that we have to do in the prevention mindset puts us in a different place and relationship with the families. So our tier 1 training is sort of designed to sort of address that and sort of invite the questions and invite the learning from the social workers in the field that workforce, the workforce for here and now for prevention work may look different. And what does that mean in terms of how you're thinking? Also, we created the requirement that counties bring through the AB 2083, your interagency leadership teams is another place where we've encouraged counties to engage and bring tribes to that team, as well as lived experience. I mean, we came out the gate really early on that, and we had to back up and reset the requirements around it and make sure that we did the right thing and require counties to bring folks to their ILT teams, their interagency leadership teams. We are also at the state engaging parents, and we will begin engaging around how to support motivational interviewing and training and coaching and implementation from that aspect. That is a different way to teach workers how to engage with families, how to engage with parents. Very different than how we do now. So we're supporting the onboarding and statewide training to start looking at that as a statewide strategy for case management. And then, of course, focusing on the community pathway. How do you keep people engaged? Taking a page out of what we learned this morning, admitting our errors and thinking about how we set that community pathway up is real important. I think for the state, as we begin to set up our statewide advisory community pathway subcommittee, those will be some of the strategic areas that we'll need to address in those meetings, how to better direct counties to engage in that pathway using some of the strategies we heard here today. And then finally, using technology, creating a social platform that we are calling CalPrevents. Is a platform to build a culture of partnership. We are just building that now, and counties are setting up those spaces where they'll be able to bring all of their partners and their community and their tribes there and engage on topics, specific topics and areas that are relevant for this season of prevention and identifying services and supports, just a place for that dialogue. So those are just a few areas that I can mention that we are trying to help counties make that shift and engage differently around the experience with tribes and lived experience folks. One more I can think about. I have to say that leadership is very important in this. We at the state, are fortunate to have our leadership with Kim Johnson and others. We have established a very meaningful tribal consultation process. We have also are working very closely with our Yurok and Karuk tribes with their prevention planning efforts, making sure that we honor and listen to the way that those services need to be in place, because that's where true prevention is when you really think about how tribes operate with their families. And then we have established what we think as a model is a state level Indian child welfare work group, where we are strategically prioritizing the areas around prevention and other parts of our system continuum.
That's a lot, Cheryl. That's great. Thank you so much. I'll go to our next question. So what technical resources is the state providing to counties and tribes to support data collection and tracking? Aside from CARES, will there be a database, ongoing technical support?
So, that's a loaded question, as they say. Once CARES is developed, we'll make sure that we include what's happening with the FF, Families First work, and then we'll provide guidance at that point. Other than what I mentioned about the CalPrevents as a technical area for collecting data or tracking resources. Aside from CARES, we don't have an additional database at this point for tracking. We at the state track services through our Office of Child Abuse Prevention. We have a database that we track service delivery and outcomes there, but it's attached to those funding sources that are used to maintain children and families in the home. It hasn't been identified as a source for FFPS at this point, but we're open to any proposals that folks will find a path to make that work if there are ideas for that, and as well as the type of ongoing technical support that people need. I would imagine with boots on the ground, counties have a better idea of what they need and what they need to track. And we're always open to you lifting that conversation up to the state.
Great, Cheryl, thank you. So I think we have time for one more question. This is, when will we know when the state is going to add or welcome other evidence-based practices?
Well, right now we are currently getting in place our continuous quality improvement system and our model fidelity monitoring system. We are working with Chapin Hall to put that in place. So once we have that process in place, we will look at adding EBPs. And of course, new EBPs are likely to be added to the plan. We constantly have gotten those requests. However, if it's an EBP that's not well supported and it will require an evaluation, it requires additional supports and funding that we may or may not have. But we are at least looking at one EBP in our next iteration, for example, wraparound, because we think that this state is positioned to raise that up and maybe consider evaluating that to bring it to well supported. And then also, it also provides a window and a pathway to provide those other culturally relevant services. So get the system in place first and then identify EBPs that need to be added, but prioritization goes toward, looking at wraparound at this point.
Wonderful, thank you so much. That segment goes by so quickly. So thank you, Cheryl. And Junious, thank you for being here to answer any potential additional community engagement questions that should have come in. Really great discussion. So for our next section, I'd like to introduce again Cheryl and Mariana Gutierrez from the Community Action Partnership of San Luis Obispo. So welcome, Cheryl. Welcome, Mariana. I'm going to turn it to both of you to discuss the state of prevention in California.
Thank you again. So as I said, let's go to the next slide then. We can move right into the presentation. So you've seen this slide before, many of you, and you may not have, but once again, this sort of articulates the vision that was placed in our plan. It's sort of that if-then statement. You know, if we shape our policies, then prevention partners and family strengthening agencies can do child and family safety, well-being, making sure that we strengthen the capacity of our communities, work effectively together, all of those things, leveraging our resources. But I think the true vision is to establish this integrated statewide system that's grounded in equity, that supports families to provide that safe, stable, nurturing relationships. We've been talking about relationships and environments for children, youth, and families so that we can do prevention and prevent the child abuse and neglect, child maltreatment from happening. So that's our true line of prevention vision. And it's consistent with what we've seen in plans. It's in alignment with cross initiatives, moving further upstream to be able to support families. Next slide, please. So how are we doing this? How are we achieving this? It means everyone here at this convening and within our local communities are collectively achieving this vision. Let's start and celebrate the 52 counties that have submitted their comprehensive prevention plans, including Yurok and Karuk tribes. That manifested the intent that this is your early blueprint and roadmap to building your community prevention continuum. We've heard a lot of that framed today, and we look forward to hearing more of your action steps around that. We also are doing this with making sure that those plans address all these levels with strategies around primary, secondary, and those tertiary strategies. It's a tongue twister. But the intent is you must match those, when we talk about fairness and equity, I am of the opinion, let's not let that be cliche. The intent must match an actionable task to change the dynamics and be able to engage with those communities that are greatly impacted. We heard that today from Junius's presentation. And so that's the shift that has still to be made in the moment. And I don't know about you, I think some people are under the impression that things for families have gotten better, but in some situations, things for families have gotten worse. Building and strengthening that primary prevention early, looking at those early interventions, things that people need, families need to be able to address the harm, potential harm, to address the elements of things that they need for living in their communities, where they work, where they go to school, where they need to get health care. Being able to assess and identify what are the community needs. We've all talked today in your meetings about how do you assess. You've been given access to, I think, a wonderful toolkit around how to make those assessments. So continuing to do that work. And then again, this whole thing about increasing capacity for true integration between the systems. That is not easy work. It's hard work. We acknowledge that. And, to the extent that you are utilizing the tools, the technical assistance, and the supports that we are offering via these types of convenings, consultants, the things that we can offer at the state with our consultants to help you achieve that true integration through systems and supports is how we achieve the work that we're all here to do. And just keeping in mind that it's about holistic models of care, I think this is a very important priority with our Secretary Gailey, to look at whole child, whole family, and whole community approaches. Next slide.
I think that's my cue.
Yeah.
Hi, everybody. Mariana Gutierrez here. I'm with Community Action Partnership of San Luis Obispo. Specifically, I am our county's community action agency. I'm going to first start us off with giving you guys an understanding of what is the difference between a community action agency that differs us from other nonprofits. Although most poverty-related organizations focus on specific areas of need, at the community action agency level, we reach out to our local communities to address their multiple needs through a comprehensive approach. We develop partnerships with other community organizations and administer a full range of coordinated programs designed to have a measurable impact on our community. From our Family Resource Center perspective, we here at CAPSO have a total of 6 Family Resource Centers that we oversee. In our county, though, we have a total of 9, if I'm not mistaken. What are the trends that we have noticed? Pre-pandemic, and I do want to make sure we note that there is a big difference between pre-pandemic time, during the pandemic, and post-pandemic. Our local Family Resource Centers during pre-pandemic time, we noticed a lot of just basic needs, addressing food insecurity, clothing, housing navigation, resource navigation, a quick service, a quick short stop. During the pandemic, we started to see the needs increasing. Yes, basic needs was still needed, housing, but then we noticed a big increase in health, educational needs, utility assistance, more complex legal issues. Post-pandemic, which is the time we are today, we've noticed benefits, concerns in benefits or need of benefits, local cash, CalFresh, cash aid, and health insurance. Mental health services was a huge increase in our area, affordable housing, again, basic needs and legal services. From a CBO's perspective, what are the changes in policies and practice and law that positively impacted us in our ability to integrate ourselves within our local government agencies? I want to note a couple. First and foremost, the Family First Prevention Service Act. This allowed us to be a voice and be part of our county child abuse prevention plan team. In the law aspect, our Mental Health Services Act provided the funding in order to sustain our family resource centers and our family advocates. It created that level of foundation. It's not easy to sustain a family resource center or our family advocates. So the Mental Health Services Act really provided that level of foundation to be able to us to get more connected within our community. At a practice level, the introduction of family advocates in our collaboration with child welfare systems within their child family team meetings allowed our local social workers to fully understand the family advocate model, to understand that they can have a CBO on the table to facilitate and assist the families. The child family team meetings, of course, comes after the introduction of a CWS system. But this, what allowed us to do is social workers become more aware of our Family Resource Center and family advocate model, making sure that those referrals or those families that are coming into their unit or coming into their agency can get connected at the prevention level before they are actually within an open CWS case. Next slide, please. So I mentioned earlier that the Family First Prevention Service Act allowed our local CBOs, or specifically our family resource centers, to be introduced and be included in the in the framework for the comprehensive prevention plan. We introduced our SAFE system of care. And what our SAFE system of care has been a long-standing a project developed in 1998 in our SLO County area. It is to ensure, our goal was to ensure all children kept safe, healthy, at home, in school, and out of trouble. The SAFE system of care here in San Luis Obispo, it is not a program or a project, but rather a strength-based way of integrating and delivery of services through a multidisciplinary team approach. It is a partnership between local school districts, county departments, and other community-based organizations. It is a mutual agreement of understanding where we as a collective group come together to serve the family with the family's voice in mind, with the family present. To be able to coordinate all this, wasn't easy. As you can see, it was created in 1998. It's still standing. And in 2023, the program, the county recognized and included the Family Resource Center framework into the county's comprehensive prevention plan. The safe system of care follows the following values that were identified. It created a multi-agency case planning that would include the parent, the child, and development of a single plan. It created collaboration and coordination of service delivery to eliminate narrow intervention, fragmentation, and duplication of efforts from other organizations or agencies. It created a co-location of multiple agencies staffed to improve communication, promote cross-training, and improve understanding of each agency's resource and strengths. It provided a continuum of service to create levels of services within an enhanced system of care that allows clients to be met in the least restrictive manner possible. And of course, it created a culture competence via bilingual and bicultural family advocates, as well as government agency staff to focus on improving access to culturally diverse groups. You've heard us before mention other populations that are coming in. Mixteco Indigenous is a big one for us in our community. So we're wanting to make sure that we're aware to provide the services in their language and understanding their culture. It provided a community-based intervention to provide services in the neighborhood, schools, and homes of families involved. A lot of the time you hear family resource centers as a brick and mortar. Our family advocacy model is a partnership with the school district. So it's having our family advocates in the school, but that does not create a barrier in meeting the families at a park, at a government agency, in their home, wherever they feel most comfortable. We created a child and family centered service directly involving the family in planning the process, supporting and developing natural family resources and strengths. It was very imperative of us to identify the parents as having a voice within these case plans that we created for the families in order to have them involved and have the buy-in for a more successful outcome. And of course, interagency case planning for families, which involve multiple agencies to determine the most efficient plan. Next slide. So what still needs to be done? Funding. You heard me earlier mentioning the funding of the Mental Service Health Act, but funding is always going to be something that we always have to keep in mind. The beauty of work is our ability to respond to what the community is in need of. We leverage smaller funds by utilizing smaller local grants. We braid and blend our funds with other community partners. So we work in partnership with our government agencies, other nonprofits, and our school districts. What do your partners need to know about the work that we do? Partnerships can be great. And in order to sustain them, we need to maintain the relationships with all our partners. We understand it's easy to say, we're going to get together as a collective group and we're going to do this. But when it comes to the planning and implementation, we need to recognize the relationships between all organizations and maintaining those relationships. We recognize the approach of our work with the whole family approach, which means we will be asking about the grandmother in the home, the uncle that may need support as well. And if we're aware of the whole family and their needs by focusing on the prevention area of services. Next slide. I believe that's my slide, Cheryl. Yes, okay. Now you heard Cheryl and I discussing the prevention, the collaboration, the partnership. I want to ask you guys all in this room a question, is what comes to mind when you see this list right here, this slide in front of you? What are the first thoughts that come up to mind? And go ahead and include them in the chat. Any takers? Or I just can't see it. Oh, there we go. Connections, yes. Comprehensive, wonderful. What else am I seeing? Robust, partners, collaboration, absolutely. As you can see, we have many great minds in our team currently here that bring valuable input and perspective to a collective work. We have the knowledge and the power to create and maintain positive change. If you can take anything from this presentation, it is this framework right here, this picture. We are part of just a small part of a collective group. Thank you. Next slide.
Okay. As you can see here, this is all of the initiatives that are occurring across the state. We need to look at what's happening across the state with other initiatives. At my level, trying to have more of a bird's eye view, no pun intended, when I got birds in my slide. But there's a lot of exciting things happening that align with the work that we're doing in social services, and there's all these opportunities that like Mariana mentioned for us to work together to break down silos and support the communities so that we can improve the quality of life for everyone. And you probably will look at this, and families will look at this and say, this is a lot. This is a lot. And the impact of that is it too much for these families coming in their life that they're overwhelmed? It's not that. You just want to be positioned so that when a need is identified, it can be met. So it does not have to come from child welfare alone. That is a huge point to keep in mind in terms of as we build this network, as I would like to call it, like we've been talking about creating a community of hope. It's a catalyst, once again, going back to many years of you used to say it takes a village, and people used to just say that as cliche, but now this is truly the opportunity where it does take that village and all the entities. So you have the ability to do all the stuff that we've been talking about, sharing data, the objectives are common, making sure things are trauma informed and evidence-based practices. One thing about evidence is don't miss the fact that sometimes the greatest evidence is the families and the tribes as well. They have the best evidence of what works in their family, if given that help. And sometimes we forget that, and we don't get so hung up on some of the research EBPs, but consider that families are still the best evidence of what's happening, what's best for their families. And, just improving well-being overall. How do you coordinate access to care? Those are the things. These are things that we've heard all throughout. And I think most important is being able to establish accountability. I took a page out of what Junious was saying in thinking going forward as a state entity about the data and, not using the data as always lifting up as I got you, but in terms of looking at the data very differently, in terms of building a different kind of structure in terms of how you look at that data. So there's the alignment of programs is important, but think of it more as a village concept. And then I think for us as a state, we want to truly, truly offer strategic pathways and technical assistance tables for folks to sit at so we could work through this, having a learning mindset, having a learning spirit, because we don't know it all. And as a bureaucrat in that regard, knowing that there's some humility and humbleness that comes with the work that we do and being able to be accountable, but at the same time being willing to admit our errors and be open to change. I think that's what we've learned. I think that's what I take away from these 2 days, that we can't do it alone, and that we're here positioned to, accomplish what we set out to be. The other thing that I wanted to take a page from what I heard too, in terms of doing a lot of these initiatives, is orienting people, the lived experience folks, when they come to the table, thinking about ways so that they can understand the language and the work and the things that we're doing. So I think we skip that step a lot. We invite people to the table and we throw them in there sort of like on the job training, wrong approach. I think there's something to be said about providing more support and orientation for kids and families is a huge point for me. And then also at the end of the day, making sure in all of these initiatives, there are champions. Know who your champions are in your organization at the state and the local level. That is important in terms of being the vehicles for being a vehicle for change. Next slide. So I believe these are questions about keeping this going. A lot of you have looked at your goals for this year. As I said, who are your champions? And how you're going to overcome those challenges, and keeping your eye on that North Star, keeping your eye on the vision, being vision focused, mission driven in that way. And there's taken away from these 2 days a lot, I think, are really, really key points for keep creating that village that I was referencing. So just wanted to add my final points there. I don't know if Mariana had something to add for that too as well.
Cheryl, you did phenomenal. You rounded that last slide perfectly, but I do see a question, if you don't mind. If I ask you this question, someone did include it in the chat, if we have time, of course. I'm going to say yes, because I don't hear a no.
We have time for a quick question, very quick.
Okay, real quick, just one question. Cheryl, you mentioned the importance of community-defined supportive practices. However, the clearinghouse process, which makes things eligible for IVE funding or for funding, prioritizes EB evidence-based practices with extensive peer review research. How do local CPPs fund community practice or make them more eligible for the clearinghouse?
So I would suggest that if there's a particular practice that you want to lift up, and there's some agreement with your CPP group to look at that, if they want to designate funding that we've given in the state block grant money or other funding, it's all about the evaluation and how to do that. You have to be willing to lift up those evaluations and be able to do that in a timely manner. So time's not always on our side for this kind of work. And research, of course, takes time. So I don't have like a golden answer for that, but I think you have to work with your local community, work with your local county or region. The state at this point is going to lift up where we can, as I mentioned earlier, what we can research and promote quickly in the time frame that we have the funding wraparound. So it would have to happen at the local level, and a decision would have to be made how to bring that forward to the clearinghouse.
Wonderful. Cheryl, thank you so much for answering that on the fly. Much appreciated. Thank you both for the wonderful presentation. You're appreciated. And I'd now like to introduce Kira Cummins from Implematics, who'll be sharing more on CalPrevents. So Kira, when you're ready, welcome. Hello, nice to see you.
Hi, everyone. Good afternoon.
We have probably about 7 minutes or so.
Okay, great. I'll take it. 7 minutes is perfect. Perfect amount of time. Okay, so good afternoon, everyone. My name is Kira Cummins. I'm a consultant with Implematics. Next slide, please. So I'm here to present on CalPrevents, which some of you may already be familiar with. CalPrevents is an online community of practice that aims to build child, family, and community well-being across the state of California. And it's been designed and developed by Implematics with the support of Casey Family Programs and the Office of Child Abuse Prevention. And Statewide Connect is our first space on CalPrevents, which is designed to bring together individuals and teams working on prevention efforts throughout California's tribes and counties. Next slide, please. So what is CalPrevents and what can you do on CalPrevents? So CalPrevents connects and allows you to connect and collaborate with different peers across the state. So peers, experts, to learn from one another and work collaboratively in an online environment. It's also meant to inspire and innovate. So you're able to share experiences, celebrate diversity, discuss best practices, and explore innovative ideas to enhance your prevention programs and work. And you're also able to access valuable resources. You can gain access to a growing array of resources, support, and expertise to enhance your prevention work. Next slide, please. So on CalPrevents, which you'll get a quick tour of in a moment, you can use the directory of members to contact peers, send DMs, send private messages to other members, ask questions in our conversation board, and respond to other folks' questions. You can share research papers, any sort of documents, PDFs, Word documents, and more. And you can also access recorded meetings and webinars, as well as in the future, there'll be live courses, meetings, and events held in this online space. And you will also be able to access in the near future other spaces on CalPrevents in addition to Statewide Connect for unique affinity groups based on topics, geography, and more. Next slide, please. And this slide really goes over who our members are. So really folks working in prevention all across California, including FFPS program county staff, tribal members and representatives, county welfare directors, Association of California, RTAs, CPOC, community-based organizations, other groups and lived experts working in prevention, and TA partners and more. Next slide, please. So before launching CalPrevents in August of last year, we spent some time doing research to really understand what are the best practices for online communities, for communities of practices, and for online communities of practice. And as part of that research, we did interviews with Title IV counties and tribal prevention staff. And we also held feedback groups. We had both an advisory group and a statewide user group. Next slide, please. And what we heard from counties was that counties were in different places in the completion of their CPP and implementation plans. Counties were receiving different guidance across the board, and that there's ample information out there, but a lack of knowing how to access and share information. We also heard that there's a need for county peer supports, groups rather, to have an easy way to share, communicate, and solve common problems and share best practices, and that counties don't have the opportunity to learn from each other and innovate and share best practices, or also avoid any hurdles by learning from each other as well. Next slide, please. Great. So here we have our request to join form, which I'm going to throw in the chat right now. And I will now share my screen and give everyone a quick tour of CalPrevents so you can see for yourself. And with that link, the request to join form link, once you fill that out, you'll receive an invite to your email. And we just ask that you check your spam folder because some folks receive it in their spam folder. Okay, so this is Statewide Connect, which is a space on CalPrevents, and eventually we will have more spaces, like I mentioned earlier, on CalPrevents that represent different geographic regions or topic area and more. And this is our homepage here on Statewide Connect, so it really outlines what the purpose of this space is and what you can do on Statewide Connect. Just gonna slowly kind of breeze through it best I can since we don't have too much time. And this is that request link to join. And once you're in here, you can introduce yourself by filling out your profile. And there's information about that and so on and so forth. So I'm going to jump over to the conversation board. And this is similar to a feed like in Facebook, for example, where you can post questions, you can post resources, you can, let's see, post PDFs, so on and so forth. So you're getting a sense of the posts that are in here right now. Oh, it's pulling up the profile. There we go. This looks like there's information about open positions as well. So this is the conversation board in Statewide Connect. We also have hashtag topics. So this is a way to organize information. And if you click on any one of these, it'll pull together, whether it's a resource that's posted or something in the conversation board, it's a way to organize information. So these are our set hashtags that are in use currently. And then there is also a resource hub that's growing. And here we have some helpful links, approved comprehensive prevention plans links, how to contact CDSS. This is definitely growing out, and every space here in Statewide Connect can have its own set of the same features. So a home page, a conversation board, a resource hub, and also the ability to host meetings or webinars or events inside the space. And then we have a list of all of the members who are in this space as well. And it's a great way to reach out, connect with folks, doing something similar, doing different. You can reach out individually to people on here. You can start a group conversation. You can also just post publicly on the conversation board. So lots of opportunity here. And again, if you'd like to become a member of CalPrevents, yes, it looks like someone's asking to share the link again. I'm going to go ahead and share it again in the chat. And yeah, and I'm sure that's something that can get sent out afterwards as well. And that's it. It's just a quick little preview, and we hope to see all you joining us soon in CalPrevents. Thanks so much.
Kara, thank you so much for going through that. I know that was an expedited presentation process, so thank you, and especially for the tour. Much appreciated. So hopefully folks will get a chance to join if you haven't already. So, before we wrap up this incredible 2 days, I wanted to just direct your attention to upcoming events happening throughout the state related to our prevention work. So as you'll see here, the Northern Training Academy, the Academy for Professional Excellence in Child Welfare Development Services, the California Training Institute, and the Office of Child Abuse Prevention have a lot happening over the next 2 months. So we'll provide a few links in the chat, and also these are hyperlinked in the presentation as well, which everyone has access to, I believe, through the resources tab. So you'll see those come in. And also just want to highlight that CDSS, OCAP, and the Child Abuse Prevention Center is doing an April Child Abuse Prevention Month webinar series. So it'll be a different webinar and different topic each week pertaining to prevention. So encourage you all to join that as well. All right. Next slide. So we are coming to the end. Thank you all so much for attending the convening. We really appreciate your time and energy, and also really value your feedback. So if you can please take a couple of minutes to complete the evaluation survey, it really helps us to understand better your experience here over these last 2 days, and it helps our planning for next year, for 2025. So the link will be going into the chat, and I know a lot of you are in person, so you can scan the QR code here and begin to fill out the evaluation survey that way. So let's see, take a moment to, we'll leave it up for a second so folks can scan that. And while you all are doing that, I just want to share, I've been really honored to be your MC today, and really appreciate, like I said, all the time, hard work and energy that went into making this happen today, and also to each of the counties for all of the incredible in-person work and or hybrid work that you did. I'd like to thank everybody who made this event happen, from the planning team who's been meeting since August, to the site leads, the facilitators, the ASL interpreters, closed captioners, our behind the scenes tech team for a truly incredible effort, and all of our presenters, Alyssa, Janae, Junious, Cheryl, Mariana, and Kira. Thank you all so much for a wonderful 2 days of learning and sharing. As I mentioned, please take a moment to fill out the evaluation survey, and we look forward to seeing you next year, of course, and continuing the dialogue from here. Thank you all very much.